Welcome to Direct Primary Care Benefits Podcast, your resource to understanding how DPC and the direct care model is fixing healthcare for employers and individuals alike. Learn from the most innovative and disruptive business executives, brokers, physicians, and healthcare influencers that are in the trenches, changing the way employee benefits are being administered across the country. I'm your host, Brett Shoemaker. All right. Well, welcome to episode 3 of Direct Primary Care Benefits Podcast. This is your host, Brett Shoemaker, and I have got Mr. Ryan Morin today with us from Savvos Health, and I'm excited to have him and appreciate you, Ryan, for making the time to be on the call today.
Yeah, well, thanks for having me. Appreciate it.
Yeah, absolutely. Well, listen, Savvos Health, I was actually introduced to Savvos Health by a good friend of mine, Mr. Harlan Pickett, and he mentioned to me what you guys do, and I immediately was like, wow, this sounds like a game changer and something that definitely is going to help revolutionize the way that direct primary care is delivered to patients and payers alike, providers, the whole 9 yards. And so what I want to talk about, Ryan, a little bit before we dive into that is a little bit about you personally. You know, I'm a huge baseball fan. My kids all played baseball and still playing baseball. And you actually graduated. You're in what part of Utah are you in?
American Fork, Utah. It's about 45 minutes south of Salt Lake City.
Okay, so you guys are 45 minutes from Salt Lake, and you went to college at Southern Virginia University and played ball there. Why don't you tell me a little bit about that experience and how college baseball was?
So went out there, wanted to get out of Utah. I'd never really left the state too much, so wanted to kind of get away, get on my own, and went out there, played for 5 years, and had a wonderful experience, fulfilled a dream, played baseball all growing up. And, you know, it was always my dream as a kid to play college ball, and I fulfilled that. And so we were, I would say probably, I mean, it's a smaller school, Division III, but it was probably one of the toughest conferences in the country for Division III baseball. We had a lot of teams and schools within our conference that were all nationally ranked, typically within the top 10, if not that top 15 for Division III baseball. I know a few years ago, one of those schools actually, the year after I graduated, went on and won the Division III College World Series. So it was a lot of fun. We had some great competition, played with some great guys, and just a great overall experience. Loved it, and what was great as well is I was out there playing ball. I met my wife, and that's where we started our family. So it was just a fun experience getting to play and fulfill, a dream that I had since I was a little kid. So
nice, man. Well, let me ask you. I got to ask, what position did you play?
So majority of the time I played shortstop. My last 2 years there, we kind of got a stud who managed it a little bit better than I was. So I finished my time at SVU over at second base. But all middle infield.
Middle infield. I love it. That's what my son primarily, my 13-year-old primarily plays middle infield and a little bit of center field. So some similarities there. That's awesome, man. Well, congratulations on you being a college athlete. I always find you being in a family-owned business, which we'll talk about here in a minute, as the director of business development. It's always cool to have that mindset of I like to call it a warrior, right? Like if you're competing at a high level in college sports, you kind of have to have a warrior mindset. Would you agree with that?
Oh, absolutely. And I mean, to that point, it's a grind. I mean, whether you're playing, whatever division it is, I know I played for a smaller school, but it's still a full-time job. I mean, between school and sports and working out and practice, I mean, you're always there, and there's so much opposition, and you learn so much. I love that. You have to be a warrior, so I couldn't agree more with you.
I love it. So you talked about family. So tell me a little bit. So you're married. You have some little ones. Let's talk about that real quick.
Yeah. So I've been married in July. It was 4 years now. My wife and I, we have 2 beautiful children. So my son, he turned 3 in July. His name is Dawson. And then my daughter, she'll actually be 2 here in November. Her name is Rose. So we get this all the time. We did not name them after the Titanic. That was kind of a coincidence. Didn't really think of that. It just got a funny coincidence. We've never actually seen the Titanic, neither her or myself. So that's what makes it even funnier. But yeah, 2 beautiful children, love them to death, and it's great. My 3-year-old loves baseball. Been watching the MLB with me since he was 18 months old. The kid loves to play. He's natural left-handed batter, throws right-handed. So, he's just like the perfect shortstop. So,
there you go. It sounds like you're You're already molding and influence them in the right direction. I love that, man.
Yeah,
So
that's right.
so tell me, the CEO of Savvos Health is actually your father. So tell me what that's like, and tell me a little bit about, the history of the company, what you guys were before, because I know you guys have a little bit of a story and a transition. So why don't you talk a little bit about what it's like working with Dad, and how you guys started in the genesis of Savvos Health.
Yeah, so I mean, it's a lot of fun. My family owns a few family-owned businesses, and so it's always been fun to work for my dad growing up. His background is in human capital management. He had a firm out here in Utah called Magellan HCM that he ran, for 15 plus years. They were in 40 states when he sold back in 2018 to launch. At the time, our company was called Glass Frog, and so I've worked for him in the past, and my family's just really close, so it's kind of a dream, and it's really fun to work for my dad. Get to really just kind of learn his experiences, learn everything that he's learned in business, and have it pass that on to me, and really just learn, his whole background and learn about the industry. It's helpful for me to ask him questions, and he's really taught me a lot as I've kind of jumped into the healthcare space and really on the product side here with Savos. So, but yeah, it's a lot of fun. I love working with my dad, and we have a close relationship, so it is a blast. I typically don't tell people that very often. I don't like people to think, about nepotism or, this is why I have my position. So it's very few people get to know that Lou is my father, our CEO. So, but it is a lot of fun. I really enjoy it, and being a part of a family company is a ton of fun as well. So, but yeah, I kind of, mentioned the background to, I guess, the precursor to Savos is in 2018, our CEO, Lou, like I mentioned, his background in human capital management. One of their largest divisions was employee benefits. So he has a background selling health insurance. He has a background in the insurance space with a lot of level funded, self-funded plans. So when in 2018, after the passage of the Affordable Care Act, kind of seen a few years, I think about at that time, 4 years of regulations with the Affordable Care Act and some of the unintended consequences, saw a huge need for change in healthcare. So sold his human capital management company to his business partners at the time, and then launched, at the time, it was called Glass Frog. And we were really more of this playful data tool that was meant really to be sold direct to consumers. Dabbled a little bit in the employee benefit space, mostly for small employers as this alternative to health insurance or to employee benefits. Our platform was meant to help members, one, find affordable cash-pay facilities in their area, and then we bundled it with some prescription tools like GoodRx and whatnot, and some others like international prescription tools. And then we partnered that with telemed as well as like dental and vision discount plans. And it was a great little plan. And we sold that to these small businesses that couldn't afford health insurance because, as we all know, premiums are out of control and they couldn't afford it. And even if they could afford it, they were really screwing their employees over anyways because the plans weren't that great. And now their employees didn't qualify for marketplace plans. So the small businesses absolutely loved what we were doing. And one of the issues we found in selling direct to consumers in these small businesses is there was always that one aspect missing of catastrophic protection because we were simply a data tool. We didn't provide any sort of coverage. And so in tandem with what we were doing, we partnered with some health shares, with some local health shares, and we're using that and kind of selling for these local health shares on top of our Glass Frog product and bringing that in there. But realized towards the end of, I'm trying to remember now, towards the end of 2021, realized we were really competing with these health shares and there wasn't really a model. We saw a huge need for really useful technology in the third-party payer space. So we realized we were really kind of competing with them, trying to sell these benefits. And so some would want, Glass Frog, they'd want the health share or whatever benefit we were trying to sell them, or they'd want one or the other, and it just got really difficult. And so we saw this huge need and made a transition in January of this year, January 3rd, actually, of this year. We spent the whole fourth quarter of 2021 transitioning from this playful direct-to-consumer, direct-to-small business model into an enterprise model to Savvos Health that we launched January 3rd. So we transitioned from this direct-to-consumer model to this complete end-to-end financial technology solution and data solution for third-party payers to help them contain their costs on medical needs and claims costs for these self-funded groups. So there's a little bit about the history of how we came to be Savvos Health.
Awesome. Well, listen, I have a ton of questions now for you. So explain a little bit your model now, because we're talking to the people that listen to this podcast. are business owners and brokers primarily that are really learning the self-funded space and understanding this new innovative way of doing healthcare, which is obviously what direct primary care is all about. And obviously Savos is a huge tool that helps that. So explain a little bit about when we talk about third-party payers. Let's break that down and explain a little bit of what that means and kind of the business model that you guys run and how you guys actually operate.
Yeah, of course. So for us, a third-party payer, I guess because there's so many different definitions of it. For us, it's whoever manages the claims of whether it's a health plan or a Healthshare, whoever's paying out those claims. So for us, typically our clients are going to be, what we call anyone from this, what we call this this creative market of emerging third-party payers. So we're talking Healthshares, creative insurance products, or almost insurance products like a health matching account, a bind, a sidecar health that are focusing on cash pay. TPAs, large employer groups that are self-funding, captive insurances. So that these health plans that are able to be creative and nimble to access cash payments for claims costs. And so what's unique about Savos is we focus on immediate cash pay settlement for all medical costs. What you're seeing is this huge shift in the market right now. And I mean, to kind of put some context onto this, our CEO, Lou, was a broker for a number of years. And if you talk to him about this, he's very passionate about this and where the market is heading, because it's very telling. Where you look about 4 or 5 years ago, if you ever asked a broker what type of, health plan or insurance they had for their family, they would never be caught dead saying, oh, I have a Healthshare or some sort of fringe benefit to that effect. They would be on the BUCA, they'd be on United, Blue Cross, Cigna, etc. Well, just probably a year or two ago, Lou and I were in our office with a few brokers, probably 3 or 4, and Lou asked all of them the same question. He asked all these brokers, what coverage do you have for your family? And every single one of them, without fail, was all on a Healthshare, even though they're selling insurance. And I think it's very telling to see that all of these brokers nowadays, a lot of the ones that we speak to are all on Healthshares. And so, and what's unique about the Healthshares is they focus on this cash payment for services. And really, in my mind, this is how they're keeping their claims costs or the needs requests down, is that they access the segment of the market or this incredible pricing through cash pay. Because what you're seeing and what we're seeing here at Savos, what we're tapping into on the supply side, on the provider side, with the surgical centers, surgeons, etc., that they're all willing to offer these incredible cash pay prices. And when you benchmark it against Medicare, it's unbelievable. They say either at or below 100% of Medicare. And they're willing to go, they can say, hey, Brett, we'll give you this incredible price, this out-the-door price. But with this price, here's the catch. Is when we deliver care, we get paid. I'm not filling out a claim form. I'm not filling out a complicated HIPAA form, then submitting it to the TPA or to the network or to whoever. And then I'm not going to wait, whether it's 14 or 30 or 60 or 90 days to get paid on this. When I give you this price, it means I get paid as soon as I deliver care. And this is where Savos steps in. When we work with our current facilities and provider partners, we tell them, when you deliver care, because we are the end-to-end financial technology solution for these creative third-party payers and even uninsured consumers, we tell them, as soon as you deliver care, our platform delivers an immediate cash payment as soon as care is delivered. And so I would say that's really our model, is we're tapping into this exploding market on the supply side of providers that are just tired of trying to fill out claim forms and complicated HIPAA forms and waiting to get paid. They just want to offer a great price, get paid as soon as they deliver care. And that's really our model, is let's give a member care and then pay their providers immediately.
Awesome. Well, I know we don't have the time to break down exactly what Healthshares are specifically, but just for our listeners out there that are listening, employers and brokers, Healthshares are obviously components that are used as I don't want to necessarily say replacement, but they cover essentially the catastrophic parts of insurance, the parts of insurance, health insurance that need to be covered for those big expenses, right? Surgeries, typically they're not emergencies, but obviously the Healthshares cover the emergency visits as well. But really what we're talking about, and correct me if I'm wrong, but really where you guys come into play is those elective surgeries. Would you agree with that, or?
Yep, that's correct. So Savos has built the nation's largest cash pay marketplace for shoppable outpatient procedures, so elective procedures. So anything ranging from imaging to diagnostic procedures like MRIs, CT scans, surgeries, endoscopies, colonoscopies, etc. So that's where we'll sit.
So when I first heard about Savos, what I related it to, because obviously we're super familiar with Healthshare, we use Sedera at First Primary Care for our kind of the plan that we bundle with direct primary care. But when I heard about it, it made a lot of sense, because one of the gaps that we find is when folks do have to have an electric surgery. Let's say it's a hip replacement, just to keep it simple here, right? Somebody has some hip pain, they have to have a hip replacement, and they're going through and figuring out which surgical centers they're going to use. Let's say they've already figured out the surgical center and the cost is $50,000 for a hip replacement. I don't know if that's accurate, but I'm just going to use that number. So let's say with their Healthshare account, they have a $1,000 IUA, right? Which works similar to a deductible. It's not a deductible, right? We know when we're talking Healthshare, we do not use the deductible term, right? But per that need, they would have, let's just say it's $1,000 IUA. And so that $50,000 surgery, $1,000 IUA, then the patient, right, is responsible for that $49,000 in the Healthshare. Well, the challenge is that most people don't have $49,000 laying around that they can just pay. And so you guys kind of, when I heard about it, operate as kind of like an escrow. So here's my question for you is, how exactly do you guys guarantee that money? Do you guys kind of work as the TPA in some instances, or do you guys how does that work? Can you just kind of break that down for me?
Yeah, and I would say it's not so much that we work as the TPA. It's more so we just go through the hassle of helping these providers figure out where they're going to get their money from. We basically become the middlemen to hunt down all of the money from all of the parties involved. So whether it's a TPA, whether it's a self-funded group, whether it's a captive, or whether it's a Healthshare, we just dive in and really work out all of these details. Because the issue you get as well within these providers is that the reason they give these great cash prices is they don't have to figure out how to bill all these different parties. Because as soon as you start involving, okay, well, I have, let's just say, XYZ Healthshare. Now they're going to say, well, hey, look, I don't want to try and figure out how I'm going to bill them, how I'm going to get my money. They don't know how they're going to get their money. So what's unique about Savos is we just plug directly into whether it's a bank account or a credit card, whatever it is from these payers and from the consumers. Savos collects the money. So when we work with these health plans, typically what we're going to do is plug in either to the claims account or some sort of account, whether it's directly with the employer or just some overall claims account for the entire TPA. We'll plug into that account. We'll pull the money directly from that account 3 to 5 business days in advance of the procedure, assuming we have that much time. And then if there's any cost-sharing responsibilities from the patient, we pull that money from the patient as well within our platform. And really what these providers are looking for, our provider partners, is when they see within Savos and we mark it within our platform, we say, hey, this procedure is now funded. They know that Savos has the full amount for the procedure. Because when they deliver care, these providers will log into their Savos account. They click a button that simply says, mark this procedure is complete. And then we submit an immediate cash payment. So we're not really trying to replace the TPA because there's a lot of things they do as far as reporting and, negotiations and claims management and whatnot. So really all we're trying to do is just make sure, one, the TPAs and their groups can access immediate cash payment. And we just make this transaction possible through our platform by collecting all the money and making sure it goes to the correct party.
Gotcha. So basically, you guys create relationships with the providers and with the health shares or TPAs to make sure that you pull that money out, and that way the providers can get paid. Is that correct?
Yep, that's correct.
Okay, so you have to have an agreement or a relationship with whatever that health share is to make this thing work. Is that correct?
Yeah, that's correct. Yeah.
Okay, so currently you guys do a lot of business with a health share that's there locally in Utah. Why don't you talk about your relationship with Zion? And my next question tied to that is, do you guys currently have a relationship with Sedera, or are you guys working that out still, or what's that look like right now?
We're definitely working that out with Sedera and a number of our other health shares. We're in advanced negotiations with them. And our relationship with Zion Health, I think, has been a very successful one. So we officially started pushing procedures through for Zion Health. It was March of this year is when we really started, ramping them up and helping their members connect with affordable cash pay facilities. And within a 5-month period, we actually have a report that generates a savings report for Zion Health. And in a 5-month period, we've saved them close to $1 million just through our platform on the elective outpatient procedures that they've run through Savvos Health. So, I mean, it's incredible the cost savings in just a short amount of time.
And when you say you save them cost savings, it's basically, correct me if I'm wrong, but the administrative outlay that they had from collecting the payments, you guys basically took that on and basically helped reduce the amount of administration that they needed to be able to facilitate these payments. Is that correct?
Well, and it's more than just administration. I mean, I think that's a little part of it. But really what we're trying to attack here at Savos is really the underlying issue in healthcare, the volatility and pricing at the facility level. Like that's the issue in healthcare. And I think what most consumers don't understand is that the issue in healthcare is not a question with your physician or your surgeon. It's a question of geography. It's where you're going. So I think an example to help paint that picture, I mean, when you talk about cash pay, there's a range of cash pay pricing out there. So I just as an example, some of the procedures we push through our platform, we helped a member with a cyst surgery a while back, and the local hospital told her, well, look, our build rate is $120,000, but because you're a self-pay cash pay patient, we'll discount that by 50% and we'll charge you $60,000. Now, on the surface, that seems like a great discount where the member and even the health plan in some cases like, oh, well, this is awesome. We're getting a 50% discount. They chalk that up as a win as, hey, we just saved $60,000. This is great. Well, the reality is 10 minutes down the road, and I'm not kidding, it was 10 minutes away, we had a solution that would do that exact same surgery for $6,500. The same scenario happened for a cervical discectomy we did in Colorado. We had the same scenario where the hospital tells the member, hey, our build rate, our average charge rate is $80,000 for this procedure, but because you're cash pay, we'll discount that to $40,000. And again, the member's telling us, like, hey, I just got a 50% discount. I think this is amazing. Like, these are great providers. But we tell them, again, just up the road in your local market, we can do this entire procedure, bundled offer, keep in mind, facility, surgeon, anesthesia, hardware, everything for $12,500. So it's more than just the administrative cost. It's, giving not just the members, but as well as the health plans we work with and their members useful tools to find affordable pricing for their elective outpatient procedures. And that's really what we try to focus on here is let's find facilities that can help these health plans move the needle, that can actually charge affordable rates with quality providers. And that's our focus. So when we talk about cost savings, it's not so much at the administrative level. It's more so at the level that we redirected these members, or in the case that we direct the members, because we catch them, from the beginning, right at the episode of care, we can direct them to truly affordable cash pay facilities that sit within a reasonable range or an affordable range for a procedure.
So you guys are in Utah, Zion's in Utah, but you guys service, is it all 49 states outside of Washington? What is your bandwidth or your collection of providers in the Texas market? Because obviously here with First Primary Care and Direct Primary Care facilities here across Houston and Texas, we have a lot of listeners and employers and brokers that are in this space, but obviously nationwide as well. So can you talk about kind of what your connections are and what your provider numbers are in terms of different states across the country?
Yeah, of course. If I had those numbers, I'd have to go plug into like some deep backend system. So if I had those numbers for each individual state, I'd be happy to give them to you. I can just send those maybe after the call. But I mean, we have a great marketplace, and I hesitate. I don't say network because we're not building a network. Because again, what's unique about Savos is we don't build contracts with these providers, and there's no contractual agreements with these prices, and there's no deep negotiation to get any of this. We simply are just asking these providers, what's your no-hassle price? The price that when you deliver care, you get paid, and that's Savos. So we truly are a marketplace, but our marketplace is nationwide. So we have solutions in every major metropolitan area across the country. And again, we are a newer company. Like I said, we launched this January 3rd, but we're taking the market by storm. I mean, we have surgical centers, endoscopy centers, imaging centers signing up every single day into the Savos platform to feature their pricing so we can connect our members with these affordable cash pay facilities. And so I think just this week alone, our provider team has signed up anywhere from 15 to 20 new surgical centers that we're adding into our platform. And this is becoming commonplace every single week now. We're just finding some incredible surgical centers across the country. But I would say as far as, specifically the Texas market, as you'd asked me, that's probably one of our strongest markets. They're in Dallas, Houston, San Antonio. There's some great solutions out there. I mean, we kind of see really Texas and Oklahoma. We feel like they were really kind of the father. These two states were the fathers of, or the episodes, or like the center of pioneering this cash pay and these affordable solutions. And so Texas and Oklahoma and that area is one of our strongest markets. But I would say we're definitely the strongest in the western states. So Utah, Nevada, a little bit of California, Arizona, Colorado, and then going into the southern, southeastern states, you look at Texas, Louisiana, Alabama, Florida, really strong, North Carolina, etc. So, but again, our reach for our marketplace extends across the country. So.
Gotcha. So let's do this. Just one little last piece here before we close out. I know we've got time here ticking, but what type of value, if we're listening to, or if we had employers listening in and brokers listening in, what type of value does Savos deliver when we talk about these self-funded plans? So I'll give you an example here. So let's say we had a direct primary care as the foundation, right? And then we had a, stop loss in place, and it's a self-funded plan, level self-funded plan. How does Savos tie into that if, let's just say, there's not a Healthshare in place? How do you guys communicate or facilitate value there when you're dealing with self-funded plans like that?
Oh, that's a great question. I'm glad you asked that. So, when we're working in the self-funded space, we'll plug into an employer group's TPA, and what will happen is the TPA will launch Savos for either just that employer group or all of their members, all of their clients, depending on, what the relationship is and how they want to launch Savos. But specifically with the employer group, we'll launch, because again, we are a self-service tool. So they'll launch Savos for all of this employer's members so they can access our marketplace and our tool to find affordable solutions in a local market. We can also tie in if they have if the employer group's using a third-party care management or concierge or advocacy team, either, in-house or maybe third-party or through the TPA, we can plug them into our platform as well. But what's great about Savos is, you look at, I look at cost containment strategies right now in the self-funded space, and you look at this continuum of affordability where you start with your BUCA contracts and you benchmark these against Medicare. You're typically 400 to 600% of Medicare. Then you start getting into your tier 2 skinny networks, and you may be 300 to 400% of Medicare. Then you get into direct contracting, and you're going to sit 200 to 300% of Medicare, and then you have reference-based pricing, which if you're lucky, you may be 150%, but you're typically 180 to 200% of Medicare if your state even accepts it. But then as you continue along this spectrum, you get into immediate cash pay settlement where Savos sits. And again, we sit either at or below 100% of Medicare. So what's great, the value to these employer groups is, one, not only can we help save, a ton of money on claims costs by helping them access immediate cash payment through our platform for their claims, for their members, for their employees. But the other incentives we look to offer through Savos is because we can save the plan so much money. One, the stop-loss carriers. Stop-loss loves working with us. I don't think we've had a stop-loss carrier tell us no or tell us that they didn't want to work with Savos. Because essentially, because our pricing is so affordable, we almost basically eliminate all spec claims for the group anyways. And then secondly, because we can save the plan so much money, we can now start offering to these employees any procedure they push through the Savos platform, whether it's a colonoscopy, endoscopy, orthopedic surgery, general surgery, hernia repair, whatever it may be, imaging. It's at no cost to these employees. And so not only does the plan save a ton of money, but then it becomes a great value to these employees to give them $0 out-of-pocket costs, waiving deductibles and copays for all of their surgeries and procedures that, and more often, in more cases than not, they're usually unexpected, right? So it's a great value add and a great tool to bring a lot of value to your self-funded plan.
So basically, you guys work, tremendously as the marketplace, like you mentioned, to the TPA, really, to kind of coordinate payments and coordinate the marketplace for people to go out and research the surgery. So let me ask you this in closing here is, do you guys have a technology that when these patients or employees of these employer groups are going to get surgeries, would they tie into just kind of like GoodRx works? You type into GoodRx, hey, I need this prescription, and then they tell you the price. Do you guys have a technology like that where the employees or patients go and look for those surgeries, or is it the TPA that does that for them? How does that work?
Yeah, we can do it from both angles. So again, Savos, we're a consumer-facing tool. So like GoodRx, if an employee has an account with Savos that the TPA pushes out to them, or whether we do single sign-on integration with the TPA's current member portal, they can launch search results just like GoodRx right within the Savos portal. And the other thing that I think we kind of forgot to mention or we didn't really talk about today, but I think would be worth mentioning here at the end of the call is Savos is really more than just a cost containment or a data tool. We are changing the healthcare experience for members, TPAs, for providers, everyone alike that's involved. Because what's unique about Savos is, let's say from the member side, a member, we'll use an ACL repair as an example. They look for ACL repairs in the local market, and then they can find affordable solutions. But really, that's the first part of what we're doing here at Savos is, one, let's guide members, help them find real solutions in their local market that have affordable pricing for these outpatient procedures. But then again, we're the one-stop shop. We are the end-to-end fintech solution for these members in this health plan. So when a member finds a solution, then within our portal, they actually initiate the process to schedule care. And so we actually connect all stakeholders within the Savos portal in one central conversation. We connect the patient or the employee. We connect their health plan. If they have an advocacy or a care management team, we pull them into the platform. Then we're pulling in the surgeon, the facility, anesthesia, all these different parties involved. Because central to the Savos portal, when we launch procedures or requests within our platform, is a messaging center where all parties, all stakeholders involved are receiving real-time updates. They're all messaging one another. They can upload order forms, medical records. And what's great about Savos is when these procedures are being pushed through the platform, again, it's creating this incredible experience where the members engage the whole time. They're communicating directly with their health plan. They're communicating directly with their providers. These providers are in real time within the portal as a health plan and member watch. They're building out customizable bundle solutions in real time. We can take any unique combination of CPT codes. Because as we know, when it comes to surgery, it's really not that cut and dry. There's always those little nuances for an ACL repair. They're fixing the meniscus. They're doing a foreign body removal. There may be 3 or 4 CPT codes, and our platform easily accounts for that as we give these providers the flexibility to, again, build these customizable bundle procedures. So before the procedure is even scheduled or even done for that matter, the health plan and the member know down to the penny what is the procedure going to cost them and what's their sharing responsibility. And then health plan and member move forward, approving final costs, approving cost sharing responsibilities, and then ultimately all that payment is submitted through the Savos platform to where we make that immediate cash pay settlement to these providers. So I think that the important thing to note is Savos is really more than just this cost containment data tool. It's a next level healthcare experience where we streamline that communication and connect everyone in one central location, making it simple and making it easy.
Yeah, you guys sound like you guys are really changing the game in healthcare, which is what I love about the direct primary care space and the whole direct care model as a whole, because it truly is changing healthcare. And I can't wait to see the legislation, changes during this session or future sessions, because you guys are definitely a big piece to the puzzle that is help solving a lot of challenges when it comes to health shares, TPAs, and self-funded plans. So last thing here, and I will let you go. I appreciate all of these questions, Ryan. You've done a phenomenal job explaining all of this. Who is responsible to Savos? So in terms of payment, how do you guys get paid? How do you guys reconcile on your end to obviously run your business?
Yeah, so our client, or ultimately who pays Savos, is going to be the health plan. So whoever's managing the claims, whether that's the Healthshare or the TPA, that's ultimately where we'll pull our money from. So the Savos is probably one of the easiest companies to work with, whether you're a health plan or an employer group or whoever it may be, because we don't have any monthly fees. We don't charge any PEPM fees to use our services. There's no setup or integration fees. We can launch Savos at no cost to any health plan or any partner we're working with. So we monetize on a transaction basis. So we charge a 10% transaction fee on the final cost of a procedure that we push through our platform. So we don't charge a transaction fee based on a percentage of savings, because, that's really ambiguous, and we probably make a lot more money that way. And our health plans would spend more to Savos than they would on the actual procedures if we did it on savings. So if we push through a $10,000 surgery, Savos makes $1,000. And when we pull the funds from the health plan to pay these providers that immediate cash payment, we just pull the Savos fee with that as well. So what's great about Savos is it's a no-risk proposition. They can launch Savos, and if they never use us, they never pay us a dime. Health plans and these employer groups only pay Savos when we can successfully help them save a ton of money on their outpatient procedures.
Unbelievable. Well, listen, I am super excited about what is happening with Savvos Health and how you guys are facilitating the fix of healthcare, because that's what we're all about here at Direct Primary Care Benefits Podcast, is really just educating the masses, brokers, employers, consumers on the better way to consume healthcare. So you guys have heard it here today with Ryan Morin is Savvos Health in Utah, and they are just absolutely doing some amazing things. And Ryan, I appreciate your time and coming on and sharing all of the information with our listeners today. And I'm looking forward to continuing the relationship and seeing what we can do together as we move forward.
Yeah, likewise. Thanks again, Brett, for inviting me. Really appreciate it. So it was great joining you today.
All right. Well, listen, guys, you have heard episode 3 here with Ryan Morin of Savvos Health. And I just want to encourage everybody to reach out and follow us, subscribe, leave us a review. If you've gotten value out of this, leave us a review, share it with all of your friends and family, and look forward to our next week's episode. And so with that being said, we're signing off. Episode 3 here with Direct Primary Care Benefits. I'm your host, Brett Shoemaker. Have a great day and God bless.